The state of Nevada has focused on the initial problem of COVID-19, which is the physical health risk associated with the virus. While taking care of the first problem, a secondary disease has increased with the shutdown of businesses, and that is mental health issues. The longer businesses are shut down and people are out of work, the greater chance of long-term mental health issues will arise. Characteristics of job loss-related complicated grief symptoms include preoccupying thoughts about loss of job, disbelief or inability to accept the loss, bitterness, and a sense of life is meaningless without the former occupation. Complicated grief symptoms following job loss can occur with symptoms of depression and/or anxiety. Even though there is an overlap in symptoms between complicated grief, depression, and anxiety, factor analytic studies have shown that these symptoms form distinguishable concepts. Further impacts may include prolonged grief, including feelings of despair, anger, and hostility, socialization, loss of control, desperation, and death anxiety. And you can see the notations on who wrote that article. More than 1 in 3 adults in the U.S. have reported symptoms of anxiety or depressive disorder during the pandemic. In comparison, from January to June 2019, more than 1 in 10 adults reported symptoms of anxiety or depressive disorder. Again, notations for who wrote. Members of Southern Nevada had the unique opportunity to meet with the United States Surgeon General, Dr. Jerome Adams, on Sunday, September 13th. The Surgeon General made a statement that stuck out, and this will be paraphrased. Nevada is in the yellow and continues to trend down. This is when businesses should start reopening. Attached is the Clark County Regional Protocols for bars, pubs, taverns, distilleries, breweries, and wineries. These protocols go over policies, safety guidelines, cleaning and disinfecting procedures, and concludes with a signed acknowledgement form from the employee and manager which states they will comply with the protocols. Clark County also created a webinar presentation, which I did share the link with you guys, for the owners of these establishments to view, which must be reviewed prior to reopening. A signed acknowledgement form, which is also shared in the link, must be kept on site for inspection. If it is not on site, the establishment will be subject to disciplinary action. Clark County is requesting that bars, pubs, taverns, distilleries, breweries, and wineries be allowed to go back to Directive 21. Clark County is also asking for churches and conventions, please review Appendix D, be allowed to operate at reduced capacity, both at 50% occupancy rates, adhering to state guidelines for social distancing and wearing of masks. Clark County is requesting these approvals go into effect 11:59 p.m. on Sunday, September 20th, 2020. Clark County would like to reference the Southern Nevada Regional Plan dated 9/2/2020 with possible action to get our youth, sports, and recreational facilities back to normal operations. And Director, I'm available for comment, and so is Commissioner and Chief Steinbeck if you have any for us.
I'll go to Chair Kirkpatrick. Do you have anything to add at this time, or do you want us to just engage in the discussion?
So I would like to add some things, Chair Cage, and because I feel that we're a little bit unique in Southern Nevada because we have established our regional committee early on back in March. And as you know, Julia talked about the potential data exposure that's out there. I want to just point out some of the great things that we have done through collaboration and partnership from the very beginning. So in the very beginning, when this all started in March, it was our partners along the Strip who came to the aid for PPE. They quickly were able to give us everything that they had in their potential locations. In fact, one hotel alone donated over 550,000 sets of gloves, which we used for truckers to bring product in, as well as our first responders, so that they had many of that. And over time, we have been working collaboratively together to ensure that public health was number one, number two, that our employees could return safely back to work, and that three, that we could continue to let our economy prosper. So that has been a big challenge for us because we rely so heavily on tourism, but we also know that our community must be safe first. So when we opened up hotels early on, we called many other states. Chief Steinbeck and myself, we spoke with New York. I called with my NACO counties to see what they were doing to put protocols in place. And I can tell you that many of our hotels go above and beyond the thermal cameras They have epidemiologists on staff. They have medical doctors who talk regularly with our Southern Nevada Health District so that we are working together. And we're testing every single employee. To give you an example, just in the last couple of weeks, we've tested over 18,000 people, and in the month of the prior month, we've tested well over 100,000 people. Another example of the collaboration in our community is at our jails. We average about 2,450 people within our jails every single day. We've tested over 11,000 to make sure that they're going through. So I'm glad that Julia spent the time to point out the data exposures that are out there so that people understand how it really works. And I feel that in Southern Nevada, we have collaborated with all agencies in a private-public partnership, and that brings me to the letters that you may have seen. I reached out to many, many bar owners across the valley who have given us our commitment that they would follow any protocols that were put in place. You also have a stack of letters from people who actually work in those locations or trying to get back to work, and the mental anguish, as Chief Samuels referred to, on the toll that it's taking on them by not knowing what next week brings. You also have many letters from churches on what their congregation is asking for, youth sports, you have those letters. So I think that we continue to be a public-private partnership, and we continue as a community to move Southern Nevada forward. We have a great leader at the top, which is it's also Chief Steinbeck, but Dr. Lagon really is a boots on the ground person as a committee member who sits on the health district. I feel like we're in constant conversation with our private sector, and I feel that our private sector is ready to move forward. And to follow up on what Chief Samuel said, you know, the Surgeon General called and gave us a quick turnaround, less than 30 hours, to give a presentation to talk about what are we doing. And I can tell you that he was highly impressed that we have 144 different languages that we have to try and make sure the message gets out on the 3 W's, which are wash your hands, wear your mask, and watch your distance. And he said that he thought we were doing a great job on doing that, and we needed to just continue to keep it up. And I believe that that's a good sign, right? When someone comes and then they tell us that we've made a difference. We had people from the Gaming Commission there, we had business there, we had pastors there, we had chamber, we had public agencies, and we spent about 4 hours with him. We showed him our isolation. We showed him how our hospital capacity works. And to refer to what Chief Samuel says, that is why he said he thought we were ready to do a little bit more as long as we stayed vigilant and followed with that message going forward. So I can just tell you that I feel lucky to be able to help chart us moving forward, and I know that our resort corridor is the top 100 employers for the entire state, and they are also committed to continue to provide a safe place for our folks to work, as well as a safe destination for tourists to come. And knowing what other states are doing, I promise you that we are the gold standard, and we will continue to be the gold standard. So that is, but I'm also ready to answer questions, and I appreciate you letting me have the floor.
Thank you, Chair Kirkpatrick. Chief Steinbeck, anything to add in addition to that?
No, sir, just here to respond to any questions you have.
So I have some questions and some comments really, and some questions. First, I want to say, you know, I think we could go all the way back to the beginning and see where Clark County has come from. And I know Kyra provided us some overviews this morning, but if we go back a month and a half ago, your test positivity was over 16%. and it's at 8.6 today. So nearly having the positivity. We know that we don't want to look at these numbers as specific dates, but as trends, and I think that trend speaks for itself. That you've been continuing to do an incredible job there. I think the surge in testing. Chair Kirkpatrick was just talking about the last month and last week amounts of testing and the HHS testing that you brought in, and as well, those are really good signs. I think the two items that I think are really helpful to me are the letters. All come through the source of letters. The letters from your bar owners and bar employees, as well as from the jurisdictions within Clark County. So Clark County, City of North Las Vegas, City of Las Vegas, Henderson, Boulder City, and Mesquite, all signing off through their elected executives on the letter regarding enforcement and returning the request, supporting the request to return back to Directive 021, I think are all positive changes. I'd like to, or positive steps. I'd like to turn it over to the members right now and see if there are other comments or other things that you'd like to point out from members of the group here regarding any of the areas that you oversee. So Director Reynolds.
Well, a couple things. There really are 4 asks in this, and I think we need to, if we're going to look at this, I think we need to take them separately. The first is bars, pubs, taverns, distilleries, breweries, and wineries. The second is churches. The third is conventions, which there's considerable amount of material in here on convention meeting gathering space on that. And then the third, or the fourth, excuse me, is youth sports. So those are the 4 areas that are addressed in the request, and I think if we're going to discuss those, we need to discuss them separately and not together. Gathering spaces are for churches, I think, is different than a convention, and so we need to break those out. And I would just make that point that if we do decide we have motions within these areas, that we break it down.
No, I totally agree. So this is Caleb Cage for the record, and I just want to say I know that this is a venue, it's a public venue where the counties are more than welcome to bring in items that are, as we heard from Story County in the public comment in the beginning, and as you pointed out, or I think as you were headed, gathering and capacity limits are determined under the statewide standards. So the phase 1 and phase 2, as we previously called them, standards, and any changes to those would have to be made during emergency directive, and we don't have the authority to do that. That's a governor's directive. We can review, we can discuss, we can make recommendations and those sorts of things as well. We do know that as recently as yesterday, Governor Sisolak said that the state is working to review those current statewide standards, including gatherings, capacity limits, and as well as all of the things regarding related to those, whether it's athletics or other things, and any of the changes or new plan related to those would have to be rolled out in the future. So with that, I would really like to focus our conversation this morning on whether or not we are talking about the Directive 21 standards and really getting to the bar reopening question. And I think that we could certainly have discussions on the other items. I think it'd be best to get an update from the governor's office and others on what those might look like going forward. So
yeah, I would agree with that, Caleb. And as you know, LEAP has also done a considerable amount of work on youth sports and getting past the stage of practice and having games and tournaments. And so we have developed guidelines going forward for youth sports and games, but it includes everything. It includes practices. It includes actual play, and also includes tournaments. So for youth sports, so, you know, that is coming out, and we're pretty close to having that, done, if not very close to having it done.
Great, thank you for that update.